Hello and welcome to Dragon Bytes, the pediatric podcast aimed at pediatric trainees or anyone interested in child health. I'm Assim, one of the pediatric trainees here in Wales and one of the presenters for Dragon Bytes. This is our second careers pod episode. This time we're focusing in on neonates. I'm joined today by Chris Corse, one of the Neonatal Grid trainees currently working in Singleton Hospital in Wales, and by Lucy Perkins, one of the neonatal consultants based in Singleton. Today we're going to discuss what drew Chris into neonatology, and then both Chris and Lucy will discuss how to improve your neonatal application with an aim to get shortlisted for an interview. Anyway, let's get started. Hi, I'm Assim. I'm here today doing a podcast about applications to the Neonatal Grid program. I'm lucky enough to be joined by the absolutely excellent Chris Corse and Lucy Perkins. Chris Corse is one of our grid trainees working in Wales at the moment. Hi, Chris.
Hi, Assim. Pleasure to be here.
Excellent, thank you, and it's a pleasure to have you. And also Lucy Perkins, one of our more recently qualified grid-trained consultants in neonates, working in Singleton Hospital in Swansea. Hi, Lucy.
Hi, Assim. Delighted to be here.
Yay! Lovely to have you with us, Lucy. So I thought, is it okay to start with yourself, Chris, first? I thought what would be really nice to know is just to get to know you a little bit. Could you tell us a little bit about your, medical career to date, where you went to uni, what you did when you first graduated, and so on?
Yeah, no problem. So I went to uni in Cardiff, Cardiff Medical School, and I graduated in 2011. After that, I did my foundation jobs in South Wales. So in my foundation year one, I worked in the Royal Gwent Hospital in Newport, and as part of that, I did a 4-month posting with their pediatrics department. In my F2 year, I did. I applied for a rotation that I thought had another 4 months of pediatrics because I thought that's what I was going to apply for. And then when I turned up to work, I found myself on their neonatal intensive care unit, which was not quite what I was expecting. But that's where I sort of got my first real exposure to neonates. I'd already really decided that I wanted to do pediatric training, so I applied to do that in the Seven Deanery following my foundation year 2 posting, but unfortunately I didn't get into it first time. And so then I went back and did a clinical fellow post, I suppose an FY3 year is what it would be called now, again back in Cardiff on their neonatal intensive care unit, and that's where I sort of really got more into neonates. And then since then I've rotated around the hospitals in Cardiff and Carmarthen, the Royal Glamorgan and Clan-Trisant, and now I'm currently working in Singleton. And I started my neonatal grid training in September of last year.
Excellent. So you mentioned that it sounded like you decided quite early that you wanted to do pediatrics. What was it that drew you into pediatrics to begin with?
So I always sort of had an inkling in medical school that I liked the idea of pediatrics, and then when I did my placement in my 4th year in Abergavenny, that's when I sort of really fell in love with the specialty. I think what makes pediatrics special is that you're dealing with a very different group of patients as compared to adult medicine. You're dealing with kids, and dealing with kids is generally more fun in my experience, in my opinion. And you can have more fun at work dealing with children. And what drew me to it initially was that basically kids are well. When they get unwell, you can intervene, and most of the time, and you can get them back to being completely well again. Whereas with adults, a lot of it seemed to me to be sort of chronic disease management, lots of polypharmacy, and trying to correct problems that people were never really going to recover from or get much better from. And I found the fact that you could get kids well again much more satisfying. So I suppose that's what drew me into it initially. I had no understanding of neonates at that point, really, and no experience of it at all. But then with my 4 months in neonates in foundation year 2, and then with my year as a clinical fellow in Cardiff doing neonates, that's when I had a sort of a bit of an epiphany moment, and really became quite passionate about doing neonates. So I think what really drew me to neonates was that the working practices really suited me. So it's an environment that you have an awful lot of control over. It's if you want to do some intensive care on a patient, you do some intensive care, and you have the skills and the ability to do that. But if you're doing really sort of holistic family-centered care with a baby that's not doing very well, or a baby that has lots of complex problems, you can do that too. And then equally, you're also seeing lots of families that are really happy, joyful time of their lives when they're having a baby, and that baby might have a few minor problems that are very quickly resolved, but you can have a really positive impact on trying to help that family through what they're experiencing. So I guess lots of people ask me, why don't you want to do pediatric intensive care as opposed to neonatal intensive care? But it's because you get to know your patients and your families an awful lot better on neonates, and you're with them through some hard times and some good times, and the good times always seem to outweigh the hard times in number, at least. I think it's a really positive specialty that you can have a really big impact, a positive impact on not only a child's health for the rest of their life, but also on the family's experience of that really hard time.
I mean, that's really inspiring. One of my questions was going to be, what's the most rewarding part of your job? But I think you just listed about 20 really rewarding things there.
Well, I do feel passionate about it. It's I think it's it's a job that it's a specialty that you can have a really you can be really helpful in. You can do an awful lot for a family in neonates through hard times and good times, and hopefully that effect lasts and is remembered by the family and lasts for that child's ongoing health and development.
Oh, lovely. Thank you very much, Chris. So we've probably got a few people who are listening in and might well be considering a career in neonatology. So if I could ask you this first, Chris, the actual Neonatal Grid training program, what does that involve?
Neonatal Grid is a 3-year program that starts at the beginning of ST6 and takes you through to the end of ST8. From my understanding, each region varies slightly in what they will put into their grid program, but all of them contain at least 2 years of that time in neonatal intensive care, so a level 3 neonatal unit setting, and preferably there should be some neonatal surgical experience as part of that. And then I know in Wales we then have the 3rd year is relatively open to being tailored to what you want it to be. So there's the opportunity to go and do transport work. So that can either be within your own deanery if you have a transport service that's approved for training, or you can venture out into another part of the country and do your transport experience there. You can take 6 months of research time if you're doing research and have that accredited towards your grid training if it's applicable. Or you can spend 6 months with an allied specialty to neonates. So my next posting is back with the pediatric respiratory team in Cardiff, but with neonatal on calls. And that's because my area of special interest for neonates is neonatal respiratory medicine. So it's 6 months to try and gain some more experience of the more complex patients and sort of their more long-term management with that team. But equally, you could do that with cardiology and learn echocardiography skills. You can go off to palliative care and get some experience there. It's a lot of my experience of more senior training is that it's really about taking control of what you want to do in the future and where you want your interest to lie, and being proactive about tailoring your grid experience to that to try and give you those skills and that experience going into a consultant role. And the scheme in Wales is very supportive for that. But that's an overview of grid, really.
Certainly, what you've described is a lot more flexible than I imagined grid training to be.
Yeah, I mean, there's the basic requirements. You have to have your 2 years in a neonatal intensive care unit, preferably across multiple sites, but that's not possible in every deanery. In Wales, we do it between Cardiff and Swansea. But yeah, then you do have 12 months full-time equivalent to tailor to what skills you want, what extra skills you want to gain on top of that that neonatal intensive care experience.
So, Lucy, what did you do then with your grid training post with the options that were handed to you?
So before I answer that, I think I just want to echo what Chris said. And for those medical students and people thinking about pediatrics, is that there is huge, the beauty of pediatric training is that it is so flexible. There's so much variety in what you can do, from being an intensive care doctor in neonatology to general pediatrics to all the specialties. When you choose pediatrics, you're not kind of narrowing your kind of options or where you can go. And even within real subspecialty training such as neonatology grid training, there's still so many avenues to explore. And I have an interest in safeguarding myself, which is somewhat unusual for a neonatologist, but it just goes to show that you make training what you want it to be, and you will be the doctor you want to be through that. And the great thing about pediatrics that ties us all together is that without going on full on Whitney with this, children are the future. And one of the most rewarding aspects, I'm not going to sing it for
Oh, please.
I will spare you that, but I think the important thing to say is that is the most rewarding part. You can be an advocate for children, for vulnerable children, but for all children, and it's so flexible. So sorry, I've stuck back in there with my medical student enthusiastic speech that they all get drilled with in Swansea, but there's so much opportunity and flexibility. Even when you're getting towards these really subspecialist stages of your training.
I don't think you need to apologise for putting out such an inspiring message at all.
But sorry, Asim. So I will now answer your question, which was what I do with it. So interesting. So I did 3 years of neonatal intensive care. So echoing, building on what Chris said, there's still and Chris, you correct me if things have changed a little bit, but as part of your neonatal training in Wales, you're still expected to do a year within a surgical centre. Then,
That's correct.
yeah, and then you need to do at least another year in another centre, and then that third year can be doing these many other sort of avenues that Chris has been talking about. I think what's key here is really thinking about what you want to do, but also what is realistic, what is possible for you, and planning ahead. So I had hoped to go to Australia to do some transport work, and I'd started getting in touch with people there after going to a conference and seeing some really inspiring talks, actually. So it's often experiences we have, people we meet that inspire us to do things. And then I rather inconveniently got pregnant with my second child. So I think the message is life. There's no people, as a female doctor, often ask you as well, when's a good time to have a family. I don't worry too much about when a good time is, and it's different for everyone. But I think that you don't feel like you can't do something because you've got other things going on, because we all have working lives and our lives at home. And for a lot of my training, I thought the two shall never meet. But it's really important, actually, when you finish within training and when you finish training, you're doing this job for the rest of your life. You've got to be able to continue your life and continue doing the things you enjoy, and investing in the friends and family that you need to be with, particularly when we do a job like we do that's very emotionally demanding as well. You need that support network and that release. So I think I actually Well, I know, I don't even think. I know. I did 3 years of training within neonatology, and I was very lucky, although I didn't go away to do some of the great things people do. And I know Chris has done some respiratory work. Lots of people sometimes do transport in London. There's loads of great options. But I spent the first year in the surgical centre, which is Cardiff, which was a great experience. And then I spent 2 years in Singleton Hospital in Swansea. And actually having that continuity of being in one place for a longer time gave me sort of a platform to explore areas I was interested in. So I did some quite big quality improvement projects and developed a bit of an interest in that. I was able to sort of drill down on what my interests are and work on those. So I think don't pigeonhole yourself in what you can or can't do. And if things need to be flexible and they change, perhaps because of your family commitments or other things going on, it's not necessarily a negative. And certainly, having done 3 years with so much clinical exposure within neonatology, really, really honed my clinical skills. And this was never more evident than when you become that consultant, you make that transition, and suddenly your clinical decision making is really put to the test because the buck stops with you. And there are always people you can talk to, but much more the onus is on you. And what I found was that the transition to consultant in terms of my clinical care of patients was a very smooth one because I'd had that exposure. Saying that, I was still able to really develop my CV and do some great work, get some great experience, despite not necessarily doing out of program work or going into a further subspecialty.
We're very lucky in Wales. All of our consultant teams are really supportive, and we'll find opportunities for you if you ask, or if they know that you're interested in a particular field. They're always looking to support trainees and to bring on their skills in what the areas that interest them. And I don't think it matters long term if you've not gone off and done this amazing fellowship in Canada, or you've gone and done some transport work in Melbourne or whatever. Those are brilliant things to go and do, but you can get different but equally as valuable experiences from your placements at home. It's about making your placements work for you, really.
Yeah, and I think looking at because I'm a big advocate of social media, and Neonates has got this really big presence on Twitter. So I think what you're saying about Wales and how supportive all the departments are seems to be just true of neonates across across the whole of the UK.
Yeah,
I think you do have people. Neonatology, it's not an easy job. There are a lot of antisocial hours. Our rotas are renowned for being slightly grueling. We tend to be perfectionists who like to beat themselves up about the smallest deviance. But it's also hugely emotionally demanding. Yet we still all do it and love it and are passionate about it, about moving it forward. And I think that passion shines through. And as you said, with platforms like social media, the world used to be a relatively small space. It is now this wide open arena. And Assim, I'd like to say your work on Drag and Bytes with Stacey, it's absolutely fantastic. You're now reaching far beyond those you could have reached doing face-to-face teaching and, in perhaps 10 years ago. So it's really about what you do with it and developing in your own niche. And certainly teaching is something, and education is something a few of us have an interest in, and it's hugely rewarding. And both Swansea and Cardiff are attached to universities, so there's a huge hotbed of things to get involved with. Their qualifications you can be looking at, and equally research. And at Singleton, we have my colleague Sujoy Banerjee, who is really excellent in the field of quality improvement. You can learn a great deal from these people, and people are passionate, and people are keen to learn and kind of share what they know, but also move things forward for our patients. So yeah.
I think neonates is a specialty that's very good at affecting change, because I think we work in smaller groups, we're tight-knit teams, and we are generally very passionate about our patient cohort. And throughout my clinical experience, I've seen more effective change happen in neonatal departments than I've seen in adult medicine or even in general pediatrics departments, just because there's that appetite to innovate and improve. And that's a great training experience.
And I think also that there's that we love a cliched quote, but there's that quote that change is the only constant in life. I think it's some Greek philosopher said it, but it's true. Within training, your ability to adapt to change, to make the most out of situations, is actually a fantastic skill, and it's probably the only thing we can be certain of. The face of neonatology in 10 years' time will be completely different to how we're working at the moment. And with the recent coronavirus crisis, we've all worked in really different ways. There's been huge challenges, but wow, we've learned a great deal about how we work, and actually there's some really positive things that have come out of it in terms of, going forward and working in different ways.
I completely get the point you're making, because it's at these times of adversity that you can see how quickly we can adapt to change.
Oh, Adam, that was beautifully said, you podcast king.
So there'll be trainees who are listening to this now who've pretty much decided they're going to be applying for Neonatal Grid. So is it okay to start with you first, Lucy? What general advice would you offer trainees who are actually applying for neonates either this year or next year?
Great. So if you've made that decision, you want to go into neonatology. Firstly, you've made the right choice. No, that was a joke.
But true.
Secondly, I think the first thing to say about the neonatal grid process, the application, the interview, is that they don't want fully fledged neonatologists. Okay, that's the whole point of grid training. They're going to you're going to have the training to do that. So don't worry if you don't have the most experience in neonatology. You haven't done every single procedure under the sun. You haven't done a pericardiocentesis on your own in the middle of the night. You don't need to worry about these things. They want to see people who are enthusiastic and passionate about the specialty and can demonstrate that in some way. And a lot of it is about talking about your transferable skills. So you may have actually done very little neonatology, but you've dealt with, you've worked in teams, you've dealt with acute pediatric situations, you've dealt with difficult communication. And there's lots of examples from within your practice outside neonatology that are great examples of why you would enjoy that specialty and why you're passionate about that.
I mean, that's really helpful. It's always worth bearing in mind that even if you don't have experience within the subspecialty you're planning to apply to, there's probably loads of transferable experiences you've had. Chris, do you have any other thoughts on or any other advice you'd offer trainees who are applying for neonates?
Yeah, I'd echo everything that Lucy said. Equally, I'd say speak to people. Speak to people that are already on grid. Speak to your consultants. Get their support, get their advice. Find out what worked, why they chosen it, what worked for them when they're applying, and try and get their input and their insight really.
And also, absolutely true, Chris. It's not a sort of cloak and dagger process. The shortlisting scoring is available on the RCPCH website, so you can see how you can score more points in different areas. And it's a really good point in your career to, if you haven't already, put together a CV, because it's really good to drill down and say, what are my areas of interest? What have I done well in? What do I perhaps need to target some more work in? And if you can do that earlier, then it gives you a bit more time when you're talking about how you can get those good shortlist scores, about how you can target areas that perhaps you can improve in, or get some more sort of evidence and points on the shortlisting form.
I mean, that's a really helpful segue because that was going to be my next question, anyways, as to how trainees can improve their scores on the application. So I suppose that first point's really important. Look at that form as early as you can, and start targeting your weak points. That's about summarizes it, doesn't it, Lucy?
Yeah, I think so. I think it also is quite a nice process in seeing how much you have achieved and what you've done. But there's no big dark surprises here. they're talking about not so much your clinical experience within neonates, as we said, but what have you done within teaching? What have you done within audit? How have you affected change, okay, or quality improvement project? Not just, oh, I did this standard audit, but I did this, I led this, we achieved this change, this is what I contributed. And you realise actually over the years you have built up quite a CV already. So it's a good chance to look at that. But certainly in these different areas, there's going to be areas where you think, well, I teach medical students a lot on the ward, but actually in terms of showing my enthusiasm for teaching, what have I done on a bigger stage? What, where have I really done something different, innovated? If you can start thinking about these things, whatever specialty you plan to go into early, it really does help when you reach these more formal processes, to have been able to give yourself the best chance to showcase what you've done, really.
I mean, that's really helpful. It's completely true. I'm saying this as someone who hasn't even applied for Grid, but I agree that when I decided to start Grid applications, by looking at that, I was surprised at how much I'd actually managed to accomplish. But it did manage to sharpen my thinking into what areas I need to target.
Absolutely. And I think you don't need to be going into Grid to do this process. I think at that time in your career, you're well into your core training as a registrar. Even if you're applying for a specialty that's not a Grid specialty at the moment, such as general pediatrics, it's really important for your career pathway to take an active interest, sit down, have a look at where you are, and really take control of where you want to go and how you're going to get there.
Excellent, thank you very much. Chris, essentially the same question. Have you got any thoughts on, with a view to getting shortlisted, what trainees can do to improve their application?
Yeah, I think as Lucy said, it's looking at that scoring framework, but it's really selling yourself and selling your achievements. I think generally we're quite a modest lot. We don't really like to blow our own trumpets. We get on, we do what we do, but we don't like to brag about it. And that's fine, because our consultants know us, our consultants and our colleagues know what we've done. They know what we've brought to a department, what we've brought to a team. The people that are marking these applications don't know us from the next application. And so it's an opportunity to really celebrate what you have done in your training, what audit went particularly well, what quality improvement project that you led did bring around this change, what research thing were you involved with, what teaching thing have you been involved with. And it's about really putting yourself over, this is who I am, this is what I can do, this is what I've done, this is where I want to go. And it not only demonstrates your skills, what you've learned and how you want to develop, but it really gives an insight into you and your passion for your job and why you want to get into a neonatal grid post.
Thank you. I think that's really helpful. I mean, I was thinking about what you just said then, Chris, because I think a lot of people when they're applying for whatever they're applying for, but we'll focus in on Grid here, is that with something like, for example, research in mind, I think people have a tendency of saying, well, I haven't done a PhD or I haven't written a paper, and then they almost dismiss that category as something that they can contribute anything to when they're applying. But actually, people, if you take a really long, hard look at things that you've done over time, you probably have been involved with research without realizing it, even if that's something as simple as doing your GCP or
Yeah, exactly.
recruiting people to trials, things like that.
Yeah, and if you look at the shortlisting framework, yes, having a PhD features on there, but it is well up the scale, and there's many things that you can achieve in the research domain before you get there. Having a paper published will get you a decent number of points on the grid application. If you've got the time, think about what, if you want to publish a paper, what kind of things to do. It doesn't have to be some medicine redefining RCT trial that you've spearheaded. It can be an article in Education and Practice in Archives of Disease in Childhood. An Archimedes article in the main part of ADC is a really good way to get a peer-reviewed, high-quality publication in a decent journal that does not take a vast amount of effort. So have a chat with your consultant, your educational supervisor, your colleagues, see if there's any ideas that have been kicking around the department for an article like that. They're not particularly long to write. It's usually just a short literature review and a bit of a commentary, but you can get a publication, and that will earn you a good few points on the shortlisting, and might be the difference between getting an interview or not for some people. But it's not a hard thing to do, and if you've got the time to do it, those are easy things to do in the research category of a grid application that will show the skills that you've got when it comes to basic research things like literature review, like critical appraisal, and those are things that are attractive at grid interview and grid application.
Exactly, and thinking like that is essentially equally true for all the domains on the grid application form.
Yeah, exactly.
I think you can be I think what's quite important, because we're saying it's great to think about it in advance, but when you're sitting there and you've laid out what you've done and you're thinking, wow, I could have scored more, you've got to be quite pragmatic. And whilst the PhD will get you 3 more points, can you do it in 2 months? Probably not. But you can, there are areas where you can certainly gain points in a relatively short time by really having a look practically on what you can do in the time you have. So an example might be, like you said, within the research domain, do your DCP. Most of these things are accessible online. But within the audit domain, you might be calling up to see if that audit which you started, the change you'd put in place, see if it's been re-audited, see if someone's shown that the change has been sustained or affected. Within teaching, you might have been put forward as an NLS instructor, for example, but you haven't got round to booking that generic instructor course. Go online, look when the next one is, see if that's possible to get in there. So people will have different amounts of time and different areas they need to target. So be quite savvy and use it in a really proactive way.
Yeah. And don't get hung up on the PhD or the Masters in Medical Education. The vast majority of people that are applying to the grid process don't have these things. So you're not going to be at a disadvantage to the vast majority of people that are applying. I don't have either of those things, and I got through grid, and that's going to be the situation for most people.
Excellent. I think that's really great advice from both of you. Thank you very much. And before we move on to discussing the actual interview itself, did either of you have any final thoughts on the application process?
I was just going to say once again, the key really is to talk to people who've done it before. So we have a fantastic bunch of neonatal grid trainees in Wales, really superb. Speak to them. People have got have done different things themselves. People have got different special areas of interest. So you can get little golden nuggets of advice from different people. And I think they really are an approachable bunch. So not only speak to your consultants, but speak to those who've done it before you, because you'll really get some great wisdom from that.
Excellent. Thanks, Lucy. And Chris, you had some thoughts on this too.
Yeah. Last 2 thoughts really. The questions for the application, although they don't come out until the September, don't really change much year on year. So speak to the people who have gone through previous years, because you're going to get the same sort of categories to talk about. And as we've spoken about, really it's the clinical experience, your research, your education, your management. Those are the 4 things that we're always talking about when it comes to medical careers. The other thing I'd say is, once you've written your application, I wouldn't say get as many people to read it as possible, but at least get 5 or 6 people to read it. And I try and get a mix of people that have gone through, are currently on grid and have gone through a recent application process. Try and get some neonatal consultants to read it. And I'd recommend trying to get someone to read it who doesn't know you particularly well, and also someone who is in a different specialty to neonates. So get somebody from general pediatrics or another pediatric subspecialty to read your application, so that there's somebody that has got is a bit more removed from the process, so that they can look at your application a bit more objectively and can look at you a bit more objectively.
So it's basically about getting as wide a number of perspectives on your application as you can.
Yeah, I mean, I wouldn't get every Tom, Dick, and Harry to have a read of it, because sometimes you can have too many opinions, and that can be a bit overwhelming. But I'd at least get 5 or 6 opinions on your grid application. That's what I did for mine, and I found that really beneficial.
I agree. The caveat is choose people carefully,
Yes.
because if you ask 20 people, you'll get 20 different opinions. So think about who you want to ask. Definitely give it to people, as Chris said. And then finally get someone you trust, who's good at grammar and English, to really, once you've got what you think is your final product, to really go over it and look at that aspect of it. So whether it's your mum or your teacher friend or whoever it is, but yeah, get someone who's removed from medicine to check your English.
Fab, excellent. Thank you both very much for that. And I just wanted to say thank you to Lucy and Chris for the fantastic advice they've given us here. Both of them are happy to be contacted via Twitter. You can find Lucy on Twitter with the handle at Dr Lucy Perkins. That's spelled DrLucyPerkins. And you can find Chris with the handle at Chris Course, which is spelled at ChrisCourse. And both are happy to be contacted via Twitter. We'll be bringing you their advice on interviews soon, but first we're planning to get out all the podcasts we have available on the application process for you, given that that deadline is a bit sooner. In the meantime, thank you for listening to Bytes.